This is an incredibly important topic. It's all about the gut microbiome, what we need to know about it, what we can do about it. What is the microbiome for people who don't know?
The majority of us is not us, but rather bacteria. So we're made up of different microbiomes. There's microbiomes on the skin, there's microbiomes in the mouth, and there's microbiomes in the gut. The microbiomes, they inhabit different portions of our body, and in the gut, there's about 100 trillion cells, all right? That's 10 times more bacterial cells than there are human cells.
It's been also compared to the garden inside of you. It's a whole other ecosystem. You are the primary provider of the food source for your microbiome, so we'll talk a little bit about that today. And I would just say that there's more than bacteria in there as well. There's viruses, there's fungi, there's a lot of interesting things residing in your gut. And once you learn to understand them, I think that it's going to really revolutionize science and medicine, as it already is beginning to right now.
We're going to be talking about the gut microbiome, but it starts in the oral cavity. So talk a little bit about that. Tell us who's living in there,
right,
and what you think are the most important things that we need to know.
Well, I mean, historically, what we've had a problem with a disconnect between dentistry and medicine. The physicians took care of the body, and the dentist took care of the mouth, and we kind of just divided and conquered. And we're starting finally to see physicians and dentists coming together and recognizing that indeed the mouth is attached to the body. The microbiome of the mouth is very similar to other parts of the body. We see a similar microbiome in the placenta. There's all kinds of different similarities in different bacteria in the body, and we're starting to recognize that maybe some of this stuff is related, and could things like periodontal disease, which is a destruction of the bone that supports the teeth, that's when things get really interesting, because the bacteria associated with that tend to lead to, or at least are associated with, other chronic diseases in the body, which we'll touch on.
What about the role of bacteria, and particularly the gut microbiome, and our immune system?
A healthy gut microbiome will lead to a healthy immune system, and an unhealthy gut microbiome makes us susceptible to all kinds of diseases, such as diabetes, such as multiple sclerosis, such as depression and anxiety disorders.
Carrie, what do we know about what's going on in the gut and cancer, for example?
Sure. So Gary talked a lot about inflammation and immunity, which are incredibly important for the development of cancer, both its development in terms of risk or preventing cancer, and also once you present either with the early stage or pre-cancer or even a more advanced cancer, with its progression, and also with survival from cancer post-treatment. Inflammation and immunity are very important for that, so I'm glad that he really touched on that. The other thing that the gut microbiome is causally involved in is obesity, which I know you mentioned, thankfully, that is one of the primary causes of cancer. It's the leading cause of cancer in non-smokers. And that's something that's very important.
So say that again, because I think that's
obesity is the leading cause of cancer in non-smokers. So first, don't smoke, then manage your weight, and part of managing your weight is also, of course, consuming a healthy diet, which is also strongly related to the gut microbiome. In healthy people who are not taking, say, antibiotics or some other type of medication, the diet is the primary shaper of the gut microbiome. So if you think upstream, it's the diet. You think intermediate, it's obesity. Type 2 diabetes also increases risk of different cancers related to insulin resistance. And then downstream of that is cancer. And so I like to say, if we could just figure out the right diet, and more importantly, get people to be able to follow those diets. I will also say that on a maybe more lower level, we also are driven by our gut microbiomes to eating behavior from the brain, and possibly even what foods that we choose or what foods that we crave could be related to the microbiome. We're doing some really cutting edge new research on that.
I am sure everyone here, when's the last time you walked down the aisle in your food store and you see the probiotic aisle, right? And I have patients ask me this all the time, which one should I take? What should people look for when they go down that aisle, aside from the pretty package?
Well, I think it's important that it's a supplement, and it's not necessarily always scientifically vetted or regulated like a medication. So it is not a true medication. I actually would recommend prebiotic food sources, They're basically all the same type of foods you've been told to consume to prevent cancer. These are healthy foods for a reason, and one of the mechanisms by which they are healthy is through the microbiome. Sometimes it's the part we take off of grains. When we have refined grains, we're removing the aspect that has the prebiotics in it. I have a lot of what's called resistant starch, which is the fuel for the gut that the microbiome metabolizes. That's one way to enrich the good things that are already there. Probiotics are a way to replenish, and those are both two ways to restore balance, but it truly is a balance. It's not a one component thing.
Anytime you're taking an antibiotic, I think you should be taking a probiotic. We take anti-inflammatory medications, okay? Everybody's upset about anti-inflammatory medications, concerned about the potential of developing ulcers. That's lovely, except 75% of the people taking long-term anti-inflammatory medications develop ulcerations in the small intestine that are quote-unquote asymptomatic, except now you've destroyed your gut mucosal barrier. So lots of things are now moving into the bloodstream that have no business being there. Also, taking probiotics seem in several studies to right the flora of the gut, get it back into balance.
What about mental health?
Depression, anxiety disorders, post-traumatic stress syndrome, and chronic pain problems, fibromyalgia, chronic headaches, chronic low back pain, are actually not diseases unto themselves, but they're actually manifestations of inflammation in the brain. So it's a neuroinflammatory disease with symptoms of depression, sleep disorders, chronic fatigue syndrome, and pain. So now if we understand that we're looking at inflammation in the central nervous system, we then begin to understand how the gut can influence that, because the gut has a huge influence on immunity and on inflammatory factors that get produced and can inflame the brain. We are getting ready to do a study to take a look at what the gut microbiota looks like in patients who suffer from a combination of depression and chronic pain. And we're trying to see if there can be a marker, if there's any particular difference in their flora versus everybody else's, that might give us some insights both in terms of diagnosis and also in terms of treatment.